Welcome, everyone. We're here today with one of our physicians to talk about colorectal cancer in younger adults. With me, I have one of our physicians, and I'll ask him to introduce himself.
Hello, I'm Dr. Teng. I'm a gastroenterologist here at Valley Medical Center. I specialize in colon cancer screening, prevention and detection, inflammatory bowel disease, and hepatology.
We've seen reports indicating a rise in colorectal cancer among younger adults in the United States. What have you observed with this trend?
Over the past 10 to 15 years, we have seen a rise in early onset colorectal cancer as defined by colon cancer in people under the age of 50. We think about 15% of all colorectal cancer is diagnosed in people under the age of 50, which is beneath the previous screening guidelines. We're actually seeing a decrease in the colon cancer incidence for people over the age of 60, which is likely due to the onset of early screening, detection, and prevention. We think that over the past 8 to 10 years, we're seeing about a 2% rise per year in the incidence of colorectal cancer for people under the age of 50, so it certainly is an alarming trend.
What are key risk factors contributing to the increased incidence of colorectal cancer in people under age 50? How much do lifestyle choices versus genetics play a role?
There are many identifiable risk factors that we think increase the risk of early onset colorectal cancer. Nothing has been conclusive in terms of there is only one cause, but we think that lifestyle certainly does play a large role. If we look at people born in the 1950s versus born in the 1990s, we see that the risk of colorectal cancer, especially rectal cancer, may be 2 or 4 times as high in people under the age of 50. So we think that exposures over the last 20 to 30 years likely play a role. We think that obesity, smoking, in addition to perhaps low vitamin D, may be associated with the increased risk of colon cancer. Additionally, there are some studies that show an increased consumption of red meats, processed foods, and sugar beverages also increase the risk of colon cancer.
Many younger individuals may not be aware of the symptoms of colorectal cancer, or they might dismiss them. What symptoms should prompt someone to seek medical advice, especially those in the millennial and Gen Z populations?
Symptoms or concern for colorectal cancer can come in a variety of forms. One of the most concerning symptoms is rectal bleeding or blood coming out of your bottom with or without bowel movements, lower abdominal pain, weight loss that is not explained by other reasons, changes in bowel habits, stool caliber, stool color, can all be concerning findings and should be evaluated by your primary doctor or a gastroenterologist.
The American Cancer Society now recommends starting regular screening at age 45 for those at average risk. Could you explain the importance of this guideline and whether there are circumstances under which individuals should start screening even earlier?
The United States Preventative Task Forces did change their recommendation from colon cancer screening started at the age of 50 to the age of 45. And that is because of what I previously discussed about the increased rise of early onset colorectal cancer. The patients that are at increased risk in addition to this screening are anyone with a family history, specifically in a first-degree relative with colorectal cancer, multiple family members with colon polyps, or symptoms as we discussed. The recommendations for screening begin 10 years prior to the onset of colorectal cancer in a relative, so could easily start before the age of 45.
What lifestyle changes or preventive measures can younger adults take to reduce their risk of developing colorectal cancer? Are there any misconceptions about prevention that need to be addressed?
So there are many different lifestyle changes that you can do to prevent or try to reduce the risk of colon cancer. Many are focused at living a healthy lifestyle, including eliminating tobacco, living a healthy life in terms of exercise and managing and having a healthy weight. We also think that having a diet that is low in red or processed meats, a diet that is high in fiber, and a diet that is low in sugary drinks or other excessive amounts of sugar is healthy and can prevent or help prevent some of colon cancer. We also think having a diet that's high in fiber and fresh fruits and vegetables may also decrease your risk in colon cancer. Many misconceptions do exist in terms of preventing colon cancer. Many think that if I'm young or healthy or don't have any symptoms that I can't get colon cancer, which is not true. We do diagnose and see colon cancer in people who are otherwise healthy and don't have symptoms, so it's important to discuss these with your doctor.
If someone has symptoms, risk factors, or a family history of colorectal cancer, what do you recommend they do next?
If you're having symptoms that you're concerned about, have risk factors, or have a family history of colon cancer, I recommend that you discuss it with your primary care doctor. You should be referred to a gastroenterologist for further evaluation to discuss what are the appropriate timings in terms of diagnostic treatment or screening.
Thank you for joining us today, Dr. Teng, and for answering our questions. And for those of you watching, if you'd like to learn more, please go to our website.